Hello and welcome to our PCC for You Educator Webinar. Really lovely to see so many people here with us today. We are hosting today's webinar from the Queensland University of Technology in Meanjin, Brisbane, and that is situated on the beautiful unceded lands of the Turrbal and Yagara peoples.
QUT acknowledges the First Nations owners of the lands on where we gather today and pay our respects to the elders, laws, customs and creation spirits of this country. For thousands of years, the First Nations owners have gathered to share their knowledge and stories. We pay our respects to all Aboriginal and Torres Strait Islander peoples and acknowledge the important role they play within our communities. We recognise their long and continuing connection to country, the lands, winds and waters throughout Australia. We recognise that these lands have always been places of teaching, researching and learning.
We just wanted to opportunity to acknowledge the traditional lands that you're coming from today. So please feel free to pop an entry in the chat, and we would love to hear where you're from today as well.
Thanks so much for sharing those. And I'd like just to extend my welcome as well. Thank you everyone for joining our collaborative team today for this webinar. Not sure if people are familiar with our work. We are a national palliative care project funded by the Australian Government, Department of Health and Aged Care. And as such, we are able to offer all of our resources and capacity building activities at no cost. So we've got the PEPA program and the IPEPA projects offering clinical placements with specialist palliative care services or interactive web workshops. And we've also got a PEPA Aged Care project arm as well, which offers these services specifically into residential aged care facilities. And you'll be able to learn more about those later on in this webinar. IPEPA, just to clarify, it's a grassroots approach to breaking down the barriers of palliative care for Aboriginal and Torres Strait Islander peoples across Australia. And the work of IPEPA is really integrated within all of the other collaborative activities and education resources. PCC for You, which is going to describe some of our resources today. We provide educators with materials and resources to support the development of palliative care knowledge and skills in the entry to practice training environment. So why is this important? The aged care workforce, as we know, is crucial for the delivery of high quality palliative care and really ensuring that older Australians can receive the care that they need and when they need it. Currently, over a third of all deaths in Australia occur in residential aged care facilities. As Australia's population ages, we know that the number of people using aged care services will further increase, as will the demand for palliative care in both community and residential care. The Royal Commission's final report highlighted that too few people are receiving that evidence-based care at the end of life and palliative care. And people instead are actually experiencing unnecessary pain, untreated symptoms, or care which diminishes their dignity in the final days, weeks, and months. And the Royal Commission also recognised and stated that palliative and end-of-life care, like dementia care, should be considered core business for aged care providers. People at the end of their lives should be treated with care and respect. Their pain must be minimised, their dignity maintained, and their wishes respected. Their families should be supported and informed. And one strategy to ensure high-quality palliative care becomes core business for aged care services was Recommendation 80, that compulsory dementia and palliative care training for aged care workers was instigated. And one of the most challenging aspects of palliative care in any setting is communication, knowing how to respond to the difficult conversations, how to broach sensitive topics, and how to build meaningful connections with people to explore their values and beliefs, which influence decision-making And these discussions are not just once off, but held over the course of a person's illness. Discussion topics and decisions may change as needs change. And these discussions might include how an illness may progress, any expected changes, how the person's coping, what the person's wishes and priorities are, changes to the person's activity or level of function, what care or help they may need now and into the future, and who is able to support them, what services they'd like to take advantage of, advanced care plan, and where they would like to be cared for and eventually die. The Palliative team have synthesised evidence around communication at the end of life and offer the following key messages that I'm sure we'll explore further today. So really, good communication underpins the quality of palliative care, and it's associated with better quality of life for older adults receiving that care. Older adults would like to take the opportunity to discuss their end-of-life needs and often value those frank conversations with healthcare providers. Older adults are more likely to wait for health care providers to raise the topic of end-of-life discussions rather than initiating the discussion themselves. And it's often not clear which healthcare providers should lead the end-of-life discussions. Preferably, this should be someone with whom the person feels comfortable with and with whom he or she will have regular contact. And often, as you be aware, in that residential aged care setting, that is often the care providers and carers. The timing, content, pace, and setting of conversations are also important in helping people deal with these difficult issues at or near end of life. Professional interpreters should be considered to enhance end-of-life care for people from different cultural backgrounds. And older adults may want practical information on how their condition will affect activities of daily living and what to expect as their health deteriorates, but they may not want prognostic information. I hope it is clear that effective communication is crucial in aged care and at the end of life. So how do healthcare providers develop those capabilities in good communication? How do you as educators or managers support students or the healthcare team members to develop the required knowledge and skills? It may be overwhelming to find resources to develop the knowledge and skills, and there's a wide range of options for education. So where do you start? And equally, some facilities may not have dedicated educators or managers, or they may be struggling to put in place meaningful education in environments with time pressures. So how do you get the best bang for your buck? On the screen are a handful of national palliative care projects which provide education resources for the aged and community sector. The team can provide you with further information on these if you would like to know more. We can have a Q&A session at the end, or we can send you some information after the day. Today, they will be highlighting the PCC for You materials, and in particular the Care Worker Toolkit, and how it can be used to support learning in the context of palliative care and communication.
What I'm here to talk to you about today is the Care Worker Toolkit that PCC for You has. It's one of our excellent resources, and coming into this role, I've found this resource a really great way to improve my communication skills in around palliative care, and I really hope that from what we can show you today, that it might be a resource that you could consider using to develop communication skills for yourself perhaps, or for your learners. A little bit about the toolkit. It's a resource that's been developed and mapped to the unit of competency deliver care services using the palliative approach. There are numerous qualifications that include that unit of competency, and the specific qualifications that this was mapped to are the Certificate 3 in individual support and the Cert 4 in ageing. The Care Worker Toolkit is designed to support learning of the palliative approach to care for students, completing the Cert 3 or Cert 4. So the toolkit's an excellent resource to use for professional development of your staff, as I mentioned, or for your own communication skill set. It contains 5 topics, as you can see there on your screen, those being principles of palliative care, supporting care, which is an element of supporting care we're going to have a look at today, focusing on communication. Providing care is another topic, end-of-life care strategies, and managing your own emotional responses to a patient. One of the things I really love about this toolkit is it's has case-based learning. So I think one of the best ways your learners can connect with material is having a real person that they can apply the theory and knowledge to. So the toolkit follows the story of a gentleman called Ben, and he's recently diagnosed with lung cancer. We followed Ben through a series of videos, I should say. We follow Ben through his journey of palliative care, and it really helps you develop an understanding of the complexities of the life-limiting illness that he's experiencing. Within the toolkit, you'll find there's 17 individual videos following Ben, not only Ben, his wife, his family, and also the healthcare providers around him. Students can explore Ben's experience of lung cancer. They can meet Jenny, his care worker, and consider how it's also impacting the family in his life, his wife and his children, while all that's happening around him. The videos are really well embedded across the material, so you don't have to go in and out of the resource to access the videos, which is really great. Some of the benefits for educators. So it can be one of the most difficult skills to develop as a healthcare provider. Many of us, even with a number of years of experience, may find it difficult to know what to say when asked a confronting question by a client, or perhaps often a family member, about dying or death. At times, the natural response can be to not acknowledge the question, to run away from the question, as well as because often we'll feel that we're not sure how to answer or we feel uncomfortable. The learning content that you'll find in session 2.3 encompasses theory and visual simulation that can help the learners at any point in their career identify strategies to communicate with respect and, most importantly, honesty with the person. Modelling from these examples can help the learner build confidence with communication. Session 2.3, which is found in topic 2, can benefit you as an educator to improve communication or connect or review or reconnect with communication principles with your learners, identify ways to use communication to build relationships with patients and families, which is often the cornerstone prior to anything else, and identify strategies to strengthen communication between family and care team during the end of life phase. So what we'll have a look at now, as you can see on the screen, this is Ben, and in the foreground here, you'll see Jenny, his care worker. We're going to take a look at a video that's embedded within the toolkit, as I mentioned before, and I find it an excellent resource because it looks at a situation where Ben doesn't particularly want to have any further care, and his care worker is navigating around that experience. So we'll play that for you now. A short portion.
Sorry to wake you, Ben. I just wanted to give you a hand to turn over so that you don't get any pressure injuries.
Hey, Jenny. Sally actually just gave me a hand to sit up and change position. This chest of mine is getting really horrible. Loads of phlegm on my chest. I needed to sit up for a bit. Felt short of breath laying down.
Your chest sounds even worse than yesterday, Ben. I wonder if you may have a temperature too. I'll let the nurse know to come and see you. Ben, I actually had a chat with the nurse earlier and I let her know that your chesty cough sounded really bad. I asked her what we could do to help your cough and she let me know that your advance directive stated that you requested not to have any antibiotics.
Yeah, that's right. I didn't see the point of treating any infections when I'm going to die anyway.
So that's just a very small snippet of that escalation process that was used by the care worker. So the purpose of this is to really help your care workers or your healthcare team to acknowledge a situation. If it's outside of their scope, to go and seek advice and come back and give the patient the opportunity to work with what treatments that they've chosen to use or not use. So I'll hand back to Sharon now, who's going to introduce us to a specialist palliative care educator, and we can talk about some more challenging questions. Thank you.
So this is Suja, who's one of our PEPA Aged Care Nurse Educators, and we have invited her along today because we wanted you to hear from somebody who is using these kind of techniques and doing this every day. So we want to start just by getting you to give a little bit of background as how you got into PEPA Aged Care.
Thank you, Sharon. I have always been interested in palliative care. My background is from aged care for the last 12 years. And I found a greater need for education in aged care. And when PEPA knocked, I was like, I'm here. So I'm doing this every day, most of the days. And it's an interesting opportunity to go back into aged cares to help staff to help educators and to help the nurses navigate. So I use Ben all the time. Ben's story does resonate very closely to what's happening on the floor. And also something to see keeps the memory, people are able to memorize it and also come back to reflect on it when there is something. So we usually will show the pieces for you videos and tell them where to go back if they have to go back and share with their teams on the floor.
Okay.
So it's been very useful.
Oh, great. Thank you. What do you think from your experience? What are the main issues around communication, particularly with regard to palliative care in the aged care context?
The staff is always very busy. So the lack of time and people able to sit and listen to the patients or form a bit of relationship. There's a lot of rostering changes. So that again moves that relationship, the comfort. So in palliative care, one of the main thing is to have some relationship, patients to feel that they can trust the team, they can reach out to the team. And I think a lot of time, because of that staffing issues, the lack of time, there is that stress on not having a good relationship, or sometimes our patients are really kind, our elderlies are really nice because they see us running around and they kind of don't want to trouble us. So that's kind of where I find we need to make that extra effort to be there for them and make sure that they feel that we will be listening and helping them.
So what do you think we talked a bit about some of the issues for communication, but what are the barriers to communication, particularly around palliative care?
There is fear. As a community, we don't see death as something very normal. So people are really scared to bring up the topic about palliative. Interestingly, we always, when we are on the floor and we're talking, when the palliative word is said, it's kind of, I'm dying, and the death, and nobody wants to have that uncomfortable feeling that I'm going to die, or the fear and emotions that's there. So it's not something that is easy to talk about in palliative care. People, none of us want to be in a place where we're feeling distressed. So we try to avoid that conversations about palliative care and what it is and what we are going to do. So the fear of the unknown or what's happening in that care needs. So I always encourage people to have that discussion when we say the word palliative. Does the patients and the family really understand what is the changes, where it's heading to, what is the expectations, or how can we ask and deal with their fears and anxiety so they have a better understanding of what care is it that they're going to receive.
Yeah, so that different understanding of what the word means.
Yes.
And that reluctance maybe to say the D word out loud is a big barrier.
Yes.
Any others that you kind of come across from your participants?
Cultural variations. So how we see death in different cultures. And I think I see a lot of staff working from different backgrounds, and we don't want to hurt anybody. We're not sure how to approach and what's the cultural practices around death. So people just don't want to talk about it. So having an openness or having an understanding or trying to understand the other person's cultural variations, backgrounds, needs from different diverse groups probably would help us better to give them a better palliative care.
Yeah. So when you're teaching this, do you have this is off book, Suja, this is a random question. Do you have ways of that you suggest people ask, particularly about cultural needs? Do you have phrases that help them to put the question to their residents?
I'm always open to listening. So I will let them know, look, this is my background. So I might not be very aware, and I'm willing to learn and adapt and give you the best care possible. And that's an opening for people to start the talking and discussion. So it's usually worked very well where you are open to discussion, open to learning, and people share their backgrounds, their variations, or what is it that they prefer. And I start to write it down so I can have it in a care plan. I can share it with the team. So that helps.
That question, the patient dignity question, isn't it? What do I need to know about you to give you the best care? I mean, it's a lovely open-ended question. That means, you've got time to listen to the answer usually.
Yeah.
Okay, that's great. Thank you. So what kind of education strategies do you use to help your learners become more comfortable and confident?
Usually in our classroom sessions, we will encourage them to start those discussions in classroom. And sometimes I say to them, it's okay not to know an answer. And we will definitely say, let's go find out and come back. Sometimes I do take Ben's stories. There's a few other stories on PCC for you. We do case study scenarios, and sometimes staff will bring their own experiences. So they share or they bring their struggles that they're having. And then we start to unpack that as a group. And then they'll take that back to the floor. I've had my learners come back to say, oh, we tried this yesterday. And then they'll come with a positive outcome, or they'll tell me or share their stories. So a lot of interactions. And I always say to them, the first one is always going to be difficult. But as they start to do it and more often, they will get comfortable with it.
As you practice it, it becomes more natural and doesn't feel like you're saying somebody else's words And so how do they respond usually? I mean, imagine that people are a little hesitant and shy to start with. Maybe not, I don't know. How does it work?
In our classrooms?
Yeah, in your classroom setting.
I find it interesting because when we are there, they welcome us we are very much welcomed. And I think I always find that they use these opportunities to learn and start those discussions. So I've never had a problem because the staff understand these opportunities are rare and they kind of want to learn more. So I'm really always motivated by the enthusiasm that they show towards learning. So hasn't had much of issues there.
Well, I can tell you all that Suja's a very easy person to talk to, so I'm sure that her learners also find that and are very comfortable. And I think when you're teaching a kind of content that can be challenging for people, taking the time to build up that rapport with them and not just dive straight into let's do challenging conversations up first.
Sometimes the acknowledgement that palliative care is difficult in itself, and I carry that throughout the days that I teach them, because sometimes as we're teaching, we also have personal experiences, so we could have emotional outflow, and I always say it's okay to have it, and then I always say, have some time, take some coffee, get back, because having those conversations is difficult. So if you yourself is not emotionally stable enough or able to hold that conversation, you need to have time, self-care, look after yourself before you look after others. So that conversation, that's where we start conversations.
And I think a lot of you in the PEPA Aged Care team start your very first session with self-care, don't you?
So start with self-care, and it's so important with palliative care to have self-care because over time people see we form a relationship with our carers, our workers, our team, our patients, family, and it's not easy to see people pass away.
It's a really important thing to acknowledge. We did want to give you an experience of an activity that we use in our PEPA Aged Care program. So I'm just going to hand over to Karen again for that. Thanks, Karen.
So what we'll do now is just while we have Suja on the line, because I really love the way Suja approaches. I really like Suja's approach, I should say, with how she encourages her learners to handle very difficult questions. So the following questions we're going to pop up, just a couple. Excellent resource tool to generate conversation in your team regarding the best way to approach answering questions that might make the caregiver feel a little bit uncomfortable. These questions can be used as an individual exercise or in a group setting, depending on what your learners look like. It's important to ensure, however, as an educator, that you have had buy-in from all your learners in regards to this activity and that you've created a safe space for everybody, so there's no judgment in relation to the answers. So what I'd like to do now is to share the following questions with Suja and identify ways in which she as an educator may assist learners develop the skills to respond to these types of questions. We'd also like to ask yourselves how you would model your responses to help your learners develop these skills also. So the first one here we have, the RN last night said that my dad is now palliative. What does that mean?
Thank you, Karen. What I would ask is, would you like to know more about palliative care? So we can start a bit of a discussion about the palliative care. Also, I would sometimes ask, would you like to know about dad's care? So again, I'll divert it back, discuss with dad about dad's care and bring it back onto palliative care. Or sometimes I would ask, would you like to know what is the changes that's happening? So it's really important to be able to ask the family or the person what they would like to hear or what they're willing to hear or what they're ready to hear. And I won't give anything more than what they can handle. It's really important because this is emotionally challenging time. Family is going to be really upset and sad. And I want to take them through that comfortable place where we can have some discussions. So I'll always ask them, what is it that they like to hear, or what is that they like to discuss? Relationship building and making the person to come to a comfortable space, really important in palliative care communication.
All right, well, we'll try another question. Common one that you'll see regardless of where you work. I don't want to take these heart pills anymore. I just want to die. So what would you suggest to your learners for this one, Suja?
One of the things to know is to understand why the patient meant, or what's the feeling of this patient before even I want to discuss this. So I usually would start with, would you like to talk about how you're feeling and why you're feeling that way? And I would ask them, would you like to talk? So that's giving that opportunity. And I will be like an active listener there, because I do want to understand why the person is feeling that they want to die and they don't want to take the medication.
Okay, it doesn't matter what's on the advanced care plan. You need to do something to save her life. I can't lose her. So this is obviously a family member saying this to you.
It's a very interesting one. Somebody's very distressed here. But I do want to have a bit of a look at, because I can see this person is already very distressed. And so I would probably acknowledge their fear of losing the loved one. And I would say, yes, I understand, or, losing a person is really difficult. So that's acknowledging that her own feeling of, I can't lose the person. And then start a little bit about, is it okay to discuss these feelings? And, and also somehow bring back the matter and gain a bit of information about how much this person was involved in advanced care planning. Because at the end of the day, advanced care planning is something that was done with the patient and we have to respect it. But we also have to get the family member to come onto the table for this to happen. So really important. And the most reason is that they are fearful of losing their loved one. So acknowledge that feeling is really important. So we kind of get to connect with this person, acknowledge that feeling of loss, and acknowledging that it is a difficult situation. And then start those discussions.
And if you're talking to care workers and this kind of comment comes up, I guess teaching them just to acknowledge the person's emotion and that they're obviously having a very difficult, this is very difficult for you. Let me get somebody. It sounds like you need to talk. Let me find somebody who can have that conversation with you, because we don't expect young students to be able to do this.
No, we don't expect, but being there for the family, being there for the person is the greatest comfort that we can give during palliative care.
Something that just came to mind there as well was the fact that as care providers, we're actually supporting our residents or the client to actually do the communicating as well. So in this situation, if the person is still able to communicate with that family member, how would you, have you come across that, Suja? How do you support healthcare providers to advocate and for the person to actually have those conversations with their family members?
So one of the things that when we're teaching advanced care planning, it's really important. And I say to them, the earliest that we have the conversations, the earliest we can get family members involved on the same page, we can take away a lot of grief from the later period. And I usually say, and it's a difficult conversation. So I usually say, one of the ways to start conversation is when your patient is telling you, this is how I want my future to look like, or this is what I want my death to look like, or my dying to look like. I start having the conversation, and then I gently ask them, have you explained this to your EPOA? Or have you had a discussion with your daughter or, like a family? And would you like me to arrange a meeting so we can all sit together? So on those lines, to know, has there been some discussion? And it's really important to have those discussions.
And I mean, you really hit this home with me once, Suja, is that it can buy you time. If you acknowledge the question, it can buy you time to have a real think about your response and work out whether that's within your scope to answer. But the most important thing, regardless of where you are as a healthcare worker, is just to acknowledge the question to make the person feel heard.
That's the great, I always say to people as I'm teaching, being there for that people, just being present there. It's not about responses. It's about our presence, being there with empathy. And being acknowledging their fear, loss, anxieties, all those difficult feelings. It helps them, any person as a family or your patient. So it gives them that you're there. The trust builds up, the relationship comes in, and then we can address the
Sharon,
issues.
thank you for that amazing conversation there, Suja. I think probably some of the key messages around this is a difficult area of healthcare. Communication can be challenging in this context, but it is so important for improving the confidence of the aged care workforce and also for the quality of life of our older Australians as well. We've got PCC for You resources that are available. You've had a bit of a touch of some of those examples today, and they can be used for RTOs to pick up for entry to practice students as well as for professional development. And we're funded to support you as educators or managers with using these in your workplaces.
Just wanted to let you know that we've got, you can look at the Care Worker Toolkit resources available on our learning management system, which the web address is there for. You do need to create an account to access the resource, but it's a free account, and we just ask for a couple of your details to set up an account. So yeah, the Care Worker Toolkit is there on the PCC for You section. And also, just with regard to the webinars, this webinar and our other previous ones are available on our YouTube channel, and we've got lots of resources on our Educator Community Hub as well.